My name is Olivia Boylan, and I am going to be talking about drinking and smoking while pregnant. So, currently drinking and smoking while pregnant is a major health concern. Heavy alcohol consumption while pregnant can lead to many health and developmental problems, such as fetal alcohol syndrome, miscarriages, stillbirth, birth defects, and problems with growth and development. There's no clear relationship between how much alcohol you drink determines how much it affects the child. As well as smoking, it can lead to many complications and can further heighten risk the more you smoke. Luckily, the current women who smoke while pregnant is at an all-time low. Official figures from the HSCIC show that 12% of women smoke now during pregnancy, which is the lowest on record. Since 2006 and 2007, the number of women who smoked while pregnant has dropped by 16%. I also came across an article stating that smoking while pregnant is associated with childhood obesity. Also, women who smoked during pregnancy were 33% more likely than those who didn't to give birth to a child whose body mass index was at or above the 95th percentile at 7 years. Most common effects of smoking while pregnant are cleft palate, cleft lip, and club foot. Cleft palate is a split or opening in the baby's palate of their mouth, which happens because the tissues do not fuse together during developmental growth. Cleft lip is pretty much the same thing, just right in the lip, so they have like a big split in their lip, and either they can have a cleft lip or cleft palate or both, which you have to have surgery to fix. And clubfoot is a birth defect that makes the feet twist in, or they even can be upside down and out of shape, which also can need to be fixed with surgery. Alcohol use among pregnant women is highest among those who are aged 35 and 44 years old, which are college-educated women, employed, and unmarried women. It is critical for doctors to constantly ask expecting moms or women who are pregnant if they're drinking or smoking. And they always advise them not to drink, and if they currently are, or if they could become pregnant. Doctors state that fetal alcohol syndrome occurs in 1 in every 1,000 live births in the United States, and other fetal alcohol disorders are believed to occur about 3 times as often than fetal alcohol syndrome. There are many signs and symptoms to tell you or your doctor if your child has fetal alcohol syndrome, which is an irregularly small head, which impairs the growth because of the alcohol, heart problems because the child does not get enough oxygen during growth in the womb, and heart problems can either be right at birth or later in life, cognitive issues because of development in the womb, and which could range from learning disabilities or a deficiency in comprehending language. Another symptom later in life could be a lack of coordination, which most likely will be seen early on when the child starts walking or practicing their motor skills. They will constantly stumble and fall and constantly be off balance. Children who have fetal alcohol syndrome also have below average senses. The two main senses it affects is their sight and hearing, which require fully functioning developed brains, which children with fetal alcohol syndrome do not have. They also can affect other symptoms such as hyperactivity and mood swings, renal complications, which has to do with your kidneys, and short height or excessive thinness, which is the exact opposite of smoking while pregnant, which leads to childhood obesity. Fetuses who are expected to drug use exposed to drugs in the uterus can also have drug withdrawal symptoms after birth. The symptoms include central nervous system irritability, which has to do with like the brain as well and all that. Gastrointestinal disorders, which is irritable bowel syndrome, hemorrhoids, or even colon cancer. And initial treatment right as the baby is born is mainly supportive, such as constant swaddling, frequent small feedings, always observing their sleeping habits, temperature stability, and intravenous fluids and replacement electrolytes may be necessary to stabilize their condition, just because their little bodies are going through withdrawal and they can't go through it without any help. And together, all these findings support the reasons why reasons why it's detrimental to be smoking and drinking to developing an unborn child. And